Welcome to Community Health Matters. I'm your host, Kristen Presall. According to a recent study, more than 1 out of every 6 adults in the U.S. is providing personal assistance for family members with disabilities or other care needs. Jennifer Abernathy, Executive Director of the Tennessee Respite Coalition, joins us to talk about the challenges of caregiving, as well as respite care options and resources. Shorter days, crowded malls, the need to please, and months of diet-busting food. Taken together, winter and the holiday season can be tough to navigate. Dr. Howard Burley from the Tennessee Department of Mental Health and Substance Abuse Services joins us to discuss seasonal stress, anxiety, and depression. And finally, we'll visit again with Janie Day of Second Harvest Food Bank of Middle Tennessee to talk about the issue of hunger in Tennessee and resources for food assistance. All of that coming up next on Community Health Matters. Did you know that a 2015 study found nearly a quarter of America's caregivers are millennials between the ages of 18 and 34? On the other end of the spectrum, caregivers ages 75 or older are typically the sole support for their loved one. Overall, the typical caregiver is a 49-year-old woman who is supporting a parent or in-law and working a paid job. She reports spending an average of about 24 hours a week providing personal assistance, such as bathing or dressing, or helping with activities such as shopping. To learn more about caregiving in the U.S. and resources for caregivers, visit caregiving.org. Did you know respite care provides caregivers a temporary rest from caregiving? It's important for caregivers to take time for themselves, and using respite services can support and strengthen your ability to be a good caregiver. To learn about respite support and resources, visit tnrespite.org. Hi, everybody. Welcome to the program. Are you a caregiver, maybe for a loved one or a dear friend? Well, then your days are probably pretty busy. But do you take time for yourself? That's extremely important. We're going to be talking about why it's so important today in this segment on Community Health Matters. I want to welcome to the program Jennifer Abernathy, who is the Executive Director for the Tennessee Respite Coalition. We're so glad to have you, Jennifer, on the program.
Thank you so much for having me.
You know, I need to share a statistic too, folks, real quick. It says, according to the 2015 study in caregiving in the U.S., nearly 44 million adults in the U.S. are providing caregiving for a loved one. If you can let people know what caregiving actually is, please.
Yeah. Well, there's lots of different forms of caregiving. With the Tennessee Respite Coalition, we consider a caregiver someone that's living in the same home of the person that they're caring for.
Okay.
And this can be somebody that is of any age, have any disability, as well as, you know, just an aging senior that may not be, you know, able to move around as well as they could in their own home.
Sure.
But then they're also nationally, you know, talking about resources for distance caregiving, because a lot of parents, aging parents, do not live in the same city as their adult children. And so those adult children are kind of doing the distance caregiving and trying to coordinate resources for people as well. So it's, you know, there's different levels to think about when caregiving.
And with technology, obviously, that makes it somewhat easier, but still.
Definitely. There's wonderful different technologies out there for people to kind of keep track and, you know, and understand what their family members are doing if they're not in the home with them. But the caregivers that are in the home all the time, a 24/7, you know, responsibility for their loved one, it can be very draining.
Yes, it can. And even though technology helps with the long distance, there are some daily challenges that a lot of these caregivers face. Can you give us an idea of some of the things that people might not even really recognize as a challenge?
Oh yeah, definitely. The one example is a call that we just received not too long ago of a parent who is caring for a child with a disability who doesn't sleep. Doesn't sleep at night, can't sleep through the night. So the challenge for that parent is to get an uninterrupted period of rest for themselves, which is, you know, of course you're doing that, you know, when you have a new child and, you know, and everything. But for some parents that have a child with a disability, they, that's their life. in entirety, and it's not going to end. So
Yeah.
so when you think about that, a nap can be challenging for caregivers.
Absolutely.
So
absolutely, that's a great example. We've heard, a lot of people have probably heard the expression, caring for the caregiver. But for people who haven't, explain what that means, please.
Yeah, caring for the caregiver is really services and actually a lot of self-care for the caregiver. Respite is the gift of time for family caregivers, and it's the time to take care of yourself. So we try and ensure that people have that time to take care of themselves and get those things done and make those social connections that they don't have time to do when they're caregiving.
If you don't mind, and not that we want to talk too much about negative things, but at the same time, it's realistic to talk about consequences for a caregiver if they don't have this support, if they don't have this time for themselves. What can happen over time for somebody who's not making those, whether it be 20 minutes here or an hour here from time to time out of their day, carving out that time for themselves? What can happen down the road?
Well, as we all know, people that do too much and don't take breaks, this is for everybody, that you burn yourself out. And caregivers can burn themselves out very quickly because they're trying to balance their work, their social life, and caring for their loved one. So, so burnout is huge. And if they're not taking the time to take care of themselves by going to the doctor, they can also have, health ramifications. They can, if they have diabetes or some kind of chronic illness themselves, they tend to ignore that, and then those chronic illnesses wind up taking,
taking them kind of out of the situation. And their health suffers because of it.
And then you're not able to actually care for the loved one because you're too sick. It's kind of like, in a lot of respite, people nationally use this analogy, is putting on when you're on a plane and they talk about putting on the air mask, when they talk about putting on the air mask yourself first and then assist the other one, that's kind of what, caregivers need to do, is take care of yourself, because then you can take care of somebody else.
Absolutely. All right, you mentioned what respite is, kind of the gift of time.
Yes.
Elaborate a little bit more on that. Give people some examples of what exactly that means.
Yeah. Well, and respite can be what the caregiver needs at the time. Respite is the time. It's not a service. It's not, that's just the word we use for the time. So we've had families that the coalition has helped that have used respite time to go on a weekend vacation, to be able to renew their vows on a beach. We have an individual who's using their respite time to have after-school care for her daughter so that she can continue working and not have to leave work early. And then there's people that use respite time to take an uninterrupted nap. That is so key, to take care of yourself. And then also continuing with social connections and ensuring that, that they have, caregivers are individuals, and a lot of times they lose that sense of self, and so respite can be used for making those connections and continuing those connections in the community.
For folks who don't have extended family, Jennifer, in their area, and they need some respite time, that caregiver does, what would you folks recommend to them in terms of trying to bring in somebody who could help out and help take care of their loved one?
Definitely. Well, you can always call the Tennessee Respite Coalition. We do have a helpline that's able to, help guide people through. But we also talk to people about finding the natural networks that they don't normally think of. Even if you don't have family in the area, you may have a church family, you may have a social family, you may have neighbors that you're very close to. And there's one kind of trick that I tell family caregivers about, is if you have things that you need done, or you want somebody to come over for an afternoon, think about those ahead of time, make the plan, and then you could put it in a fishbowl beside your door, and anybody that comes to visit, you could
great idea.
You could just have them pick something out of the fishbowl, and that would be what they can do to help you that day.
Sure.
Because when people ask, and say, "Oh, just call me if you need anything," you either forget to call, you don't know exactly what to ask them, and you just create that little fishbowl, and it solves a lot of problems.
That is such a good idea. We were sharing right before the program, I was talking to Jennifer about a personal situation with my mom and dad, because my mom's my dad's caregiver. It was interesting when I talked to you about the fact that sometimes she'll go to water aerobics or whatnot, and that's her respite time. So even small times out of the day can be refreshing and revigorating for that, that caregiver.
Exactly. Even if their loved one that they're caring for is sleeping, taking time to journal is a very nice way to get some respite, and it's also, a kind of improving mental health kind of thing. Gardening, I know caregivers do exercise and walking when they have respite time, so anything like that. And it's important that caregivers have choice in what they do with that time, because not everybody likes to garden.
Absolutely. So it's got to be something specifically for their needs and their wants and desires. So Jennifer Abernathy, thank you so much for your time today. A lot to consider and great information.
Well,
thank you.
Thank you.
Did you know the idea that suicides occur more frequently during the holiday season is a long perpetuated myth? The CDC's National Center for Health Statistics reports that the suicide rate is in fact the lowest in December. The rate peaks in the spring and the fall. This pattern has not changed in recent years. The holiday suicide myth supports misinformation about suicide that might ultimately hamper prevention efforts. The holiday season is always a fun time of year. You've got festive music and bright lights, and you get to go shopping, and it's just always a fun time. But for some folks, the stress can be a little overwhelming, and that's what we're going to be talking about today. Joining us now is Dr. Howard Burley. He's the Chief Medical Officer with the Tennessee Department of Mental Health and Substance Abuse Services. We're so glad you're with us.
I'm glad to be here.
You're going to help us navigate the holiday season.
I hope so.
Because for a lot of people, Dr. Burley, everything that I mentioned is always kind of the excitement of the holidays. But a lot of people struggle with some mental health issues during this time of year too. Can you tell us what some of the top things are that people kind of struggle with, if you will?
Well, I think you mentioned them just a few minutes ago. It's the anxiety and the depression. Those are two common disorders that happen during the holidays. And then you have the reactions to stress. People may have more headaches. A lot of times they have stomach problems. I think a lot of times we forget that stress, depression, and anxiety a lot of times come out in physical symptoms.
That's true, yeah.
And also there's a tendency towards more substance use. Excessive drinking is a common thing that happens during the holidays, especially when people say they're just trying to take a little bit of the edge off. So those are the common things that occur during the holiday season that people are struggling with.
Let's specifically talk about depression, because when you think of all of the cheer and the festive kind of environment that people expose themselves during the holiday season, you would think it would be more uplifting. But people can go through bouts of depression during this time. And if you can tell us maybe why that is.
Well, for a lot of people, it's really a joyous and cheery time. But for other people, it carries a whole different meaning. It's a time where they become withdrawn, isolated, become more prone to feelings of despair. And a lot of times it can be stress related. Other times it can be associated with things that have happened in the past. If you think about it, the holidays typically serve as landmarks for life's events. So if you've lost a loved one, if there has been divorce,
or loss of a job,
any of the other stresses that occur with just daily life, then they become more prominent during the holiday season. So when everybody else is full of joy and cheer, it's a tendency for that person to sort of pull back and go into their own shell when that's going on.
Yeah, they're reflecting on those things that might not have been
They're reflecting on the unhappy times of the year.
Yeah, well, that makes sense. For those of us who are going through this time and you're trying to stick to your calendar and your schedule and your list of things to do, you get wrapped up in it, but obviously if you are starting to have some of these kind of feelings, what are some symptoms that start coming about that you can recognize and say, you know what, I need to reevaluate things. I need to look at myself and know, because I'm doing this or feeling this way, this might be a symptom of something more?
Well, usually one of the first things that happens when people feel stressed is it impacts their sleep pattern.
Okay, great point.
Then you look around and sometimes you notice that your appetite is also changing. And then you tend to withdraw from other people. You have feelings of sadness that you don't know exactly why they're occurring. You're surrounded all of these people who are planning events, and then once again, that's another stress for those individuals because they already aren't all into the event, and then they're challenged with going to parties, house guests, all the other stresses that come along with the season.
When you notice some of those symptoms in yourself, at what point should you kind of reach out and maybe get a hold of somebody who can help?
I think it depends on the severity. Because it's not unusual to be a little bit down.
Sure.
We talked a little bit before the show started about how these things tend to resolve at the beginning of the year. If you see a pattern that's occurring with them, that this happens every year, and it's becoming more severe, that's a sign that it's probably something that's more clinical than situational. Most times when we're talking about holiday depression, we're talking about stresses that occur associated with the season. When you pull those stresses away, the person's mood starts to improve. But in those cases when it doesn't, it may be a sign of something that's more severe. And then there are some people who are more prone to being just depressed during the winter months. And if you notice that sort of cycle happening every year, then that's an indication that you probably need to reach out and help for some additional help. And then too, if it's associated with one of the life stresses, say for example, anniversaries of loved ones, or that there's been a change in your own status. I know in the elderly sometimes where we see people moving from their home into an assisted living situation, it can be a real time of depression because they're more focused on the happier times that they had in their life.
Yeah, and that's why we're talking about it, because as you had mentioned, for a lot of people, it is a seasonal thing. It's a short-term kind of feeling. For those folks out there, though, who are listening to this and they do notice, just as you were talking about, having issues with depression or having thought anxiety or having, not being able to cope with stress as well, you don't avoid the holidays, obviously.
No, you can't go into a show.
But that's true. How can you go about manage, your reacting and your feelings through this time? What are some helpful things maybe that they can do?
Well, I think the first thing you have to do is take good care of yourself. You have to be concerned about proper nutrition, getting your rest, getting a lot of exercise, trying to get out in the sunlight. That does carry a big impact. I think just recently we've seen bright sunshine and dark days, and people tend to be a little happier during those brighter days. So trying to get out and do something different. And if it's been a pattern with you in the past, one of the things you can do is try to change what you're doing this year as opposed to what you've done in the past. You can always try to get involved in more activities, volunteer. You can reach out and, for example, at work and try to be more social with people that you come in contact with on a daily basis. The more that you can kind of get away from yourself, the better it is.
Those are all great points of good information and good advice for folks to sit there and think about that. Dr. Burley, let everyone know too, since you've studied these kind of figures probably over the years, how big of an issue is this for Tennesseans each and every year? Well,
it's hard to pin down exactly just because of the nature of the depression itself. But we do know that probably 8 to 10% of the population has depression, a clinical type of depression.
Okay.
And then we know that this is much more common and much less severe. So it can be anywhere up to maybe 20% of the population may experience it at some point in time during one of these seasons that comes by. So it's a pretty common problem for people to struggle with during the holiday season.
Sure. You'd mentioned also kind of having the winter blues. That's different, though, than what we're talking about in terms of seasonal affective disorder.
Exactly.
But I guess one can accompany the other, yes?
One can accompany the other, and one can superimpose on top of the other. The winter blues, or seasonal affective disorder, is more of a clinical type of depression, and it's more associated with the biochemistry of the body.
Reacting to the elements.
Reacting to the elements. As you get less exposure to sunlight, there's certain chemicals in your body that change in their level, I guess their peaks and their lows. You get more of some and less of others, and these can make you more depressed. And then what happens is that generally in the fall and winter when this happens, the person becomes more depressed, and as we get more into spring and summer, things get back to normal as the sunlight comes out, and it resolves itself.
So we all just hope to have a very good holiday and make it to New Year, right?
We do.
And I guess you would probably agree with this. If you are suffering from something like this, don't be ashamed to tell a friend or a loved one.
No.
Make sure that you do that, right?
No. I think that's one of the things that we need to get out there, that it is just so common.
Sure.
And that really one of the best ways to get through the holidays is the support of others around you.
Absolutely. All right. Dr. Howard Burley, we really appreciate your time today.
Oh.
Hopefully you have a nice holiday as well.
You too.
All right. Thank you. Did you know that 1 in 6 adults and 1 in 4 children struggle with hunger every day in Tennessee? Programs like Second Harvest Food Bank and its more than 450 nonprofit and corporate partners are committed to feeding hungry people and working to solve hunger issues in our community. If you know someone who needs emergency food assistance, contact Second Harvest at 615-329-3491 or dial 211 for assistance. We'd like to welcome Ms. Janie Day, President and CEO of Second Harvest Food Bank, to the program. So nice to see you.
It's good to see you as well.
And great to visit with you. I know that you all constantly stay busy over at Second Harvest and do such a tremendous job for the community, so thank you for that. I will start off, though, for folks who might be new to the area or people who are not as familiar with Second Harvest, give us an idea about the organization. Tell us a little bit about it.
Well, Second Harvest is a nonprofit organization whose mission is to feed hungry people and solve hunger issues in our community. We've been around since 1978, and we actually cover 46 counties in Middle and West Tennessee. So we're not just here in the Nashville area, but we're throughout some very rural counties that have some huge needs.
We wouldn't think that hunger is still such a big issue, but it is, and not just nationally, here in the state of Tennessee. Specifically, if you can talk, Ms. Day, about Middle Tennessee and West Tennessee in which you work.
Right. Well, 1 in 6 Tennesseans and 1 in 4 children in Tennessee are at risk of being hungry every single day. Now, what that means is that they don't know where their next meal may come from. It's a very staggering figure. It is one that I never thought would be that high. But hunger is, and people think sometimes it's in certain pockets in certain neighborhoods, but really hunger could be your next door neighbor. It could be the person that you sit next to in the church pew. It could be one of the children that your child plays with at school. Hunger is very much alive in this country, but it is a problem that we can solve if we all work together.
Something I think that's so special about Second Harvest are the programs that you all have implemented over there, and several, throughout the years. You have a lot of different ones in particular. I'd love for you to tell us about some of, not that you have any favorites, I'm sure they're all favorites of yours, but tell us a little bit about, like the mobile pantry, for example.
Okay, exactly. Well, we actually partner with over 450 nonprofit agencies, and what that means is they are have a food component as part of their program, and we solicit the food from the food industry, and then we redistribute that food back out to help them feed their clients. Could be a school pantry, could be a low-income daycare center, could be a senior citizen center. All of those organizations qualify. The mobile pantry is probably one of my favorite programs. I love them all, but that probably has to be one of my favorite because you really have direct contact with clients directly. And we take out about 15,000 pounds of food on one of our trucks. We work with a local agency or church group in that community that has identified a need for families that need groceries for a certain amount of time. They then qualify those candidates and those clients, and then they arrange for us to bring the food out. It will be comprised of non-perishable food items as well as perishable food items, because we're very concerned about the nutrition of our community and how people are eating, and we hope that they'll be eating better and healthier because that makes for a stronger community.
Absolutely. You also have the backpack program.
Yes,
we were talking about a little bit about this right before this program started.
We actually were one of the first 5 food banks in the country to start that backpack program. And it's for children who are at risk of hunger. Teachers will put a supply of food that we have packaged at the food bank. It's all non-perishable food items, provides about 3 to 5 meals over the weekend that they can consume. It'll have a shelf-stable milk and a shelf-stable juice and fruit and canned meat and those kind of things, all pop tops, so the kids could open them easily if they needed to. But teachers identified this as a huge issue because they were seeing children come back on Monday and not able to concentrate, not able to learn, had a lot of disciplinary problems, a lot of health issues. And so they actually came to food banks all across the country and said, can you help us?
Wow.
We think part of the issue is these kids are food insecure, and we know if they have food and it's good and it's nutritious, they can learn. So we're very closely tied to the educational success of all of our communities because food is such a huge component of that.
Absolutely. And I would like to talk a little bit about here in just a moment about the food insecurity, but let's talk about how you determine the types of programs in which you end up coming up with for the organization itself.
Sometimes they're driven by the community needs in that community. You know, we have a lot of seniors and we have a lot of children that are very vulnerable, and so we want to create the kinds of programs that they can benefit from. But then we also know that we have a lot of clients that are limited on their transportation, so we want to make sure we're getting the food to them or getting it centrally located where they can access the food and it's not too much of a hardship. When you're hungry, you have a lot of issues, not just about being hungry, but you know, sometimes people come to us and they say, I have a high utility bill this month. You know, they're trying to stay warm in the winter or cool in the summer. So I've had to expend what expendable income I have on those bills, and I don't have enough to eat 3 meals a day. Wow. So that's why people come to us, or perhaps they're a senior citizen and they need, they've spent all their money on prescriptions, and we know you can't get better if you're having to make a choice of, do I take my medicine or do I take, or get my food?
Yeah. You know what, you're really changing lives, helping improve lives on so many levels, but can you break it down and kind of quantify the impact that you're making in terms of pounds of food in which you're able to distribute?
Absolutely. So in the very first year that Second Harvest was created, we distributed about 168,000 pounds of food. Last year, we distributed over 27 million pounds of food. 10 million pounds of that food was perishable food and produce, which is healthy and nutritious for our community. So you can see how great we have grown over the last couple of years. Also, we've seen a high, in the last 6 months, we've seen our poverty numbers increase by about 5%. So we have more families living in our service area that are needing our services now more than ever.
All right. Ms. Day, what other issues or problems contribute to food insecurity, as you just spoke of a little bit ago?
Sometimes it's utility bills, sometimes it's medical bills, it's underemployment, where after the recession, a lot of people did go back to work, but they're working at a lower salary than what they previously were working at. They still have to feed their family of 4, they still have to put gas in their car, they still have to get to work every day, and they still have to put food on their tables, and it's making it a little bit more difficult. So food prices have also gone up in the last couple of years by about 35%, and that's having a huge impact on families being able to feed their families.
All right. If somebody needs personal assistance, how can they be helped by Second Harvest?
They can go to our website, secondharvestmidtn.org, and there's a lot of different information on there where they can go in their own community, whether it's in the city of Nashville or outside Nashville. They can also call us at 329-3491. We'll be happy to answer any questions that they may have. People can do food drives if they want to help their neighbors. They can donate money, or they can donate their time and come and volunteer.
I was just going to say, you have corporate partnerships that you have had for many years. You have an excellent team of employees, but you also need the community's help in terms of volunteering.
Absolutely, absolutely. Can't do it without the community. It's all about the community.
All right. Well, President and CEO of Second Harvest Food Bank, Ms. Janie Day, it's so nice to visit with you.
It's nice to be with you.
Congratulations on all the success you all have had.
Thank you.
Thank you for your time. And thank you all for tuning in. We'll see you next time.